supportive care can really only happen when there's excellent cancer care possible. Being inquisitive is not just simply being curious, but also speculate and be intelligent and think about like, oh, what are things that we can do to improve our care? Being involved in an organization like MASCC would be able to help you to find the right people to connect and then to get the answers that you need. There's a lot of information, right, in terms of how do we make decisions in cancer supportive care, but we need to make sure that these are all evidence-based and well-informed. And
greetings and a warm welcome to the Comfort Corner, a palliative care series on OncoDaily. We aim to raise awareness about the critical need for palliative and supportive care among cancer patients with the goal of improving their quality of life. Our motto, navigating life's twist with compassion, encapsulates our mission. My name is Martin Harutyunyan. I'm a medical oncologist palliative care specialist based in Yerevan, Armenia. It is my honor to introduce Professor Alexandre Chan, a distinguished clinical pharmacist and expert in supportive care in oncology. Professor Chan is the founding chair of the Department of Clinical Pharmacy Practice at the University of California, Irvine, and has dedicated his career to improving the quality of life for cancer patients. He is also the president-elect of the Multinational Association of Supportive Care in Cancer, with over 300 peer-reviewed publications. Professor Chan's research focuses on supportive care and cancer survivorship, including cancer-related cognitive impairment and cancer-related fatigue and integrative oncology. He has also pioneered research on brain-derived neurotrophic factor and its impact on chemobrain. Currently funded by an NIH National Cancer Institute AO01 grant, he investigates BDNF augmentation in chemobrain to improve the quality of life for cancer patients. Professor Chan, we are very glad to have you with us today.
thank you, Martin. Thanks again for inviting me.
We know that your passion for supportive care in oncology started early in your career, and we are curious about the personal experiences or professional encounters that led you down this path.
Well, thank you. So I guess I can talk about a little bit about my background as a clinical pharmacist in oncology. So my background, or at least my training, was in oncology pharmacy. After my pharmacy degree, I've done some postdocs, graduate training related to oncology pharmacy. And I knew about this career that I wanted to go into to improve cancer care for patients who are undergoing treatment. And that was 20 years ago that I started working in the field of oncology. And it was interesting because as an oncology pharmacist, a lot of the work that I do, indirectly is really trying to improve supportive care by looking at, for instance, patients' antiemetic regimens before they start their chemotherapies, looking at whether or not that they're on appropriate growth factor support before they start their chemotherapy to prevent neutropenic fevers. And then, we are looking at things like how can we prevent hypersensitivity reactions. These are some of the core things that we're doing to prevent acute side effects in cancer patients. And when you're working day to day, and again, we're talking about 20 years ago, even nowadays, we still don't have a lot of, all the answers to all these problems that our patients have while they're undergoing treatment. And, when you don't have the answers, then you wanted to figure out whether you can part of finding out the solution. So I started doing trials and studies, and the best way to find out more is really going to a meeting like MASCC. Math is just fascinating, meeting a lot of the like-minded people. I still remember the first day that I met with Paul Hasketh, one of our past president of MASCC, who obviously knows a lot about antiemetics, and talking to him about like how do we tailor antiemetic regimens or so. It is so fascinating. And many of the past presidents who were there are very down to earth. It really opened my eyes. And then when again, my career continued like as an oncology pharmacy faculty at the university, I realized that I have a huge impact I can play to improve supportive care for cancer patients by looking into other side effects that are really not well researched. And that's where things that I became a lot more open to look into other toxicities like fatigue, cancer-related cognitive impairment, or chemobrain. some of these side effects that really still we don't have a lot of good answers for, and that's because we don't understand the mechanism. So kind of going back to my roots as a pharmacist, because if we're giving a drug to manage these side effects, I want to know how it works. And I think that's important because if we are not really giving treatments that sort of having the mechanistic understanding to support these patients, it's a slippery slope. Patients may not do really well, and a lot of these may not be evidence-based. So I think a lot of these sort of experiences that I have along the way that really sort of get me to where I am today, to be so dedicated, enthusiastic in the area of supportive care. Very grateful in this whole journey.
Yeah. Thank you. Your leadership at MASCC and your extensive research have not only influenced practices in the United States, but have also set benchmarks internationally. How have you been able to make such a widespread impact?
Well, I wouldn't say that I've made a lot of impact at this point. I'm still hoping that there's a lot more that I can do. I'm very grateful to have met a lot of people in my career so far who's very welcoming of having me to be involved in their projects and opportunities that I can really improve, cancer care. And a lot of the skills that to be frank, that I learned before I, sort of become the leader with MASCC at this point was my time with the International Society of Oncology Pharmacy Practitioners, or ISOP in short. So I was the past president for ISOP, and I did have a lot of experience looking into how do we improve global oncology pharmacy. But now, with again the angle of supportive care, bring a lot of the skills that I've learned in my previous position. Um, I sort of know about what are the needs that we really need to grow when it comes to oncology practitioners. And again, not just in pharmacy, but even like other professionals as well, on how do we really improve patient care? What are things that we need to do to ensure that our practitioners are getting the needs. And these needs are not necessarily just educational, like, with meetings, but, other needs like mentorship or even resources. And then thinking globally. And I think that's one thing that I also learned along the way by meeting so many people from these different organizations. I mean, there's a lot of unmet needs in a lot of parts of the world. And I think, because the fact that we have so much of these resources that we can share, I think we really can make sure that supportive care can be spread in a lot of these other places that are underserved. Because I really believe in this motto. Supportive care can really only happen when there's excellent cancer care possible. So supportive care itself makes the excellent cancer care to happen. So if we don't maximize supportive care and bring in these resources to help these other places that are lacking those needs, then we will not be able to again have that huge influence to improve cancer care. So I hope this is so to speak a messaging that can bring across not just in our nations but also in a lot of the underserved areas around the world as well.
Oh, thank you. You have mentored many aspiring professionals over the years. What advice do you give young professionals about making a real differences in this field?
I think one of the things that I want to make sure that people are always inquisitive. And being inquisitive is not just simply being curious, but also speculate and be intelligent and think about like, oh, what are things that we can do to improve our care? Because I think, there's so many of us working day to day in cancer care, and we tend to forget. Like, there are a lot of problems that are left unsolved or unresolved. And I think there are a lot of things that we can do. So we need to put on our thinking cap sometimes. And I think what's challenging is that, when we have these sort of questions in mind, we don't really know like how to get answers and how do we resolve some of these issues. And this is where your professional network really comes into play. Being involved in an organization like MASCC would be able to help you to find the right people to connect and then to get the answers that you need. Or if not, you can become part of the solution making. And I think that's something that I always emphasize. Like I myself have multiple mentors that I've met along the way in my journey, and I want to make sure that a lot of the aspiring professionals also can find their mentors and people they can work with within our organization.
We admire how you manage to juggle so many important roles. What strategies do you use to maintain a healthy work-life balance?
That's a difficult one because the truth is, like I said, because we're so busy with our day-to-day work, and I think what's challenging is that we don't have enough thinking time. And certainly keeping that work-life balance is even harder. Like, how do you ensure that, you are still providing excellent patient care and at the same time thinking about research ideas? It's a fine balance. I have to say, I do use my calendar very well. I make sure that, I put in certain times that I, would have scholarly time or thinking time so that, I'm more dedicated and can put my thoughts together. So that way it doesn't interfere with my day-to-day work. I mean, as administrator, I'm an administrator at my current position. And I think the challenge is that, when I'm so, into my administrative role, sometimes I don't even remember my clinical role. So I preserve like half a day a week. Like for instance, every Monday morning I see patients. So that way I wanted to make sure that that part of me being very clinically oriented is still there. But then to balance out with life, with family life, I think that's important. So my weekends, I really want to make sure that I preserve them for family, and I still run 3 times a week. I try to make sure that I keep up with exercise. And again, that's something that you can only do by blocking your calendar. So I think there are sacrifices, but there's also, I think there's a way to make sure that you are disciplined so that you can, do the things that you wanted to do and still maintain a healthy lifestyle. So it's an art, and I think it takes time to learn like how to make that happen for yourself.
Thank you. Your upcoming presidency at MASCC is highly anticipated. As the president-elect of MASCC, what specific changes or initiatives do you have in your mind to introduce during your leadership to enhance supportive care globally?
Well, I'm very honored to be president-elect for MASCC. I think my utmost task at this point as president-elect is to support President Florian Scott on his initiatives to improve the organization at this point. I mean, we're having a lot of frequent meetings and talking about what are things that we wanted to do. Like, for instance, President Scott's one of his, hope to happen, within this presidency is to bring up the number of membership, up to 5,000. And I think is very achievable for MASC because as I mentioned earlier on, there are a lot of places on earth that, still lacking supportive care resources. And I think there's a lot that we can bring to these countries. But I myself, I wanted to see how, as we build up the organization with a larger number of members, we need to make sure that we're providing more to our members as well. So, for instance, making sure that we appreciate a lot of the work that our members are putting in, because we are heavily depending on volunteers who's able to help us to deliver a lot of the projects, a lot of the guidelines, and things that we're doing. So, one of the things that I'm currently working on is, pioneering a fellowship program. Now, this is not a training program, but it's really a program that we're honoring some of our members who have done a lot for the organizations and certainly being seen as an expert in the area of cancer supportive care. Um, I'm also looking forward to, in terms of renewing our strategic plans. And I think it is important because we do have a lot of strategic plans that's being put together by our past presidents and also our current president. But how to, look at some of these things to move forward and to carry through in the next couple of years as well. Because I think now we have come to a very important crossroad. We are also collaborating with a lot of organizations around the world, different disciplines, whether or not this is, again, interprofessional or we're talking about, interdiscipline, like, in terms of topics. I think there are a lot of opportunities that MASS can really extend their arms and trying to make sure that, we are reaching out to all these other organizations. So I think there's a lot that we can do at this point.
We are excited about the theme for this year's meeting. The theme for March 2025 annual meeting is Informed Decisions in Supportive Cancer Care. Can you elaborate on what the theme means to you and how it will be reflected in the meeting's agenda?
Yeah, this is a very exciting meeting that's coming up. As you can see the poster behind me. Our meeting is scheduled on June 28th, June 26th to 28th in Seattle. And Joanne Bowen, who's our scientific chair, has prepared a wonderful program for our meeting. Um, so informed decision and supportive care is very important because I think we have come to the point that, there's a lot of information, right, in terms of how do we make decisions in cancer supportive care, but we need to make sure that these are all evidence-based and well-informed. And how can we do that? So I like looking at some of the sub-themes that we have our meetings. Like, for instance, one of the sub-theme is talking about how do we, manage emerging toxicities with emerging treatments, with a lot of the drugs that, again, that are newly available on the market, or even drugs that we're starting to use a lot more, like the antibody drug conjugates, for example, the ADCs. So we still don't know a lot about the long-term toxicities, some of these emerging side effects. So we need to figure out how can we better manage these side effects. The other sub-theme that's also, again, under this informed decision, which is very important, is how do we repurpose old medications for cancer supportive care as a new approach? And again, we want this, process to be an informed process, because a lot of people are thinking that, well, if we can repurpose certain drugs that's already approved, so it might be cheaper for us, or more cost effective in a way, right, to use these medications to support our patients and to minimize toxicities. But again, I think this process needs to be well informed with the evidence that we have. So, in the process of repurposing these, old or existing medications, what's the process? How should we do this? How do we look at the evidence that's available for a drug that's approved if we're trying to repurpose it for supportive care? How do we do that? So I think a lot of the decisions on how to better improve cancer supportive care needs to be well informed with evidence-based medicine. And I think a lot of the sub themes that we have for our meeting is sort of resonating with this overall theme of this meeting. So I do welcome many of you, if you haven't considered coming to our mass meeting, or you haven't joined, or you've come to our meeting, like, maybe once, like a long time ago, and you want to revisit our meeting, please join us. This is a very multidisciplinary group. I think you will enjoy a lot in terms of finding out what are some of the latest development in cancer supportive care, and also, networking with people within the field as well. I have heard so much good things about this meeting from a lot of people who have attended the meeting over the last couple of years. So I do wanted to invite all of you to attend this meeting.
So, thank you, Professor Chan, for your insights today, and thanks to our listeners for joining us. Keep exploring supportive care and join us next time for future discussions at the Comfort Corner. Take care.
Bye.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.